Hey everyone, welcome back to Discussions with Dr. G. I am Dr. G, and if you're a regular listener, you already know that I spend more time with my cats and textbooks than is probably healthy. Today we're digging into what exactly public health nursing is, and believe me, it's a lot more than poking arms with flu shots. So, at its core, public health nursing is all about promoting and protecting the health of the people and communities where we live, learn, work, and play. I know that's the tagline in just about every PowerPoint, but it does matter. Because instead of treating one patient in a room, you're kind of zooming out and looking at neighborhoods, sometimes whole cities. And I'll admit, switching that mindset did take me a little while when I first started working as a nurse. A lot of what guides us in public health nursing comes from epidemiology. If you've ever wondered how we decide what's actually worth worrying about, well, that's our epidemiology detective work in action. Identifying health problems, guiding what prevention strategies we try, and helping us figure out which interventions might actually make a dent. Let's talk about the infamous nursing process, but blown up to a whole community. It's the same familiar steps, okay? Assess, plan, implement, evaluate. Except we're doing it not just with individuals, but also with families, whole neighborhoods. You get the picture. Actually, that kind of reminds me of this time I was part of a neighborhood health assessment. We were mostly expecting questions about blood pressure or nutrition, but what caught us off guard was just how many local parents were super nervous. No, let me rephrase, genuinely worried because it was about vaccines. This wasn't even on our radar going in. That changed our entire approach because we realized the issue wasn't just access, it was trust. I ended up designing more of a programming around like talking to people at like soccer games and the local library and places like that. It really shapes your responsibilities as a public health nurse. And before we move on, don't forget the framework of prevention we're constantly weighing. Primary prevention is like, can we stop this before it starts? So, vaccines, health education, things like that. Then you have the secondary prevention, which is catching stuff early with screenings. Think mammograms and A1C tests for diabetes. And then tertiary prevention is for after the disease happens, where it's all about managing, rehabilitating, and preventing things from getting worse. Now, epidemiology isn't just a big word you'll drop in nursing school to sound fancy. These models, like the epidemiological triangle, actually shape what we do every day. If you haven't seen the triangle before, it's basically a triangle, and it's got the agent, the host, and the environment on each of the sides. And every outbreak, every disease is about something moving through one of those three sides. Think back to COVID, when the local health department started asking companies to report sick employees. It was tracing who was getting sick, how the germs moved, who shared snacks, who didn't wash their hands after arts and crafts. Textbooks tell you host agent environment. But when you watch a virus jump from a sticky table to everyone and anyone who sat there, yeah, you remember. The chain of infection is another key idea. Agent, reservoir, portal of exit, method of transmission, all the way to the next unfortunate, susceptible host. You start to really see how breaking even one link in that chain, whether it's hand washing or keeping sick kids home, can basically stop an outbreak in its tracks. Now, when we build interventions, we're always thinking, okay, which link can we disrupt? Sometimes it's obvious, like running a flu vaccine at a school in the fall. It's a perfect primary prevention example. Other times it's secondary, like doing diabetes screenings at a health fair. Or maybe even tertiary, like setting up chronic disease management programs for people who are already dealing with, let's just say, heart failure. And let's not forget how complicated these models get with real people. I mean, the textbook would say host defenses are things like your skin, your immune system, and maybe even vaccines. But sometimes social stuff matters way more. Think housing insecurity, food deserts, income, all those environmental factors that make or break someone's health. So let's talk about the big stuff, the major public health problems, which, spoiler alert, are way more complicated to deal with than I thought as a new nurse. Chronic illnesses like heart disease and diabetes are massive. Heart disease is still the number one killer in the US, costing what? Over $200 billion every year? Diabetes is just as overwhelming. A little over 37 million adults live with it. Another 96 million have pre-diabetes, and the costs are staggering. And it's not just the chronic stuff, guys. Communicable diseases are on the rise too. We saw a 7% bump in reported STDs in just 4 years, with teens, women, and people of color most at risk. Antibiotic resistance is making things trickier. Sometimes the drugs just don't even work anymore. So a lot of what we do is focused on education, making sure people stick with treatments and pushing for vaccinations wherever we can. Substance use and injury throw even more curveballs. Opioids, for example, killed more than 75% of people who died from drugs in 2021. That's wild. And suicide is the second leading cause of death for people aged 10 to 34. Don't get me started on firearm violence. We're looking at about 132 deaths a day, and most of those are suicide. Community nursing means we're constantly partnering with schools, law enforcement, mental health programs, basically anyone who'll listen in order to build environments that protect people. During an opioid spike, you will work with the health department, the local schools, the police, even community churches. The idea is going to be to set up naloxone trainings at the library or bus stops, or heck, even the local bowling alley. Without these collaborations, honestly, we'd have zero impact. That kind of multi-team approach is the only way to move the needle. And all these issues tie back to frameworks like Healthy People 2030. Think of it as the country's public health to-do list, with hundreds of objectives around things like obesity, suicide, overdose, cancer, and hypertension, and always with a focus on equity and making sure interventions actually work and last. So, just remember to be safe and competent in community health. You've really got to stay sharp on the epidemiology, prevention strategies, and all these evidence-based frameworks. This is what keeps things interesting. You never know what challenges or which community you'll be tackling next. Thanks for hanging out with me. I'll catch you next time for more adventures in public health. See ya.